All right, so I'd like to invite our panelists up from Self-Regional Community Initiatives and Access Health. We have Theresa Goodman, Brenda Anderson, and Cyndi New.
Hello, everyone. So if any of you have not met me, my name is Melissa Fair, and I have the great honor of serving on the Data Corps as part of this work and have really enjoyed being a part of it. So I'm really excited to showcase today some great local work that is going on in the Games region, or Greenwood, Abbeville, Edgefield, McCormick, and Saluda. So today we have Brenda, Cyndi, and Theresa who are going to share a little bit about the work that they are doing, specifically around access to care, using innovative technology, community health workers, and strong community partnerships to solve the unique health challenges of the rural communities that they serve. So just a little bit of quick housekeeping before we get started. There are some note cards on your table or index cards. As the panelists are sharing more about their experience in the community, please take the time to write down any questions you may have for them, and we will go through those and work to address each of them at the end of the panel. But if we don't get to any of your questions, we are going to pull together a comprehensive Q&A document in which the panelists will have the opportunity to provide additional context or information, and all of that will go out to this group. And so before we get started, just wanted to quickly introduce our panelists. The first person we have here is Cyndi New, who serves as the Director of Community Health and Health Equity at Self-Regional Hospital. We have Brenda Anderson, who is a community health worker with AccessHealth Lakelands, and Theresa Goodman, who is the Executive Director of Community Initiatives Incorporated, a free clinic in Greenwood, South Carolina. And so just to get started, would you just tell each of us a little bit about your work and your organizations?
Absolutely. But first, since I do have the mic, I do want to just say thank you. We have a room full of friends, peers, colleagues, partners, funders, and so there's no way we could do this work without everybody in this room. So we definitely appreciate that. So a little bit about Self-Regional, and as you mentioned, so we sit in Greenwood, South Carolina, which is considered upstate. It's more toward the west, and we serve our areas around that. So we're a very rural area. So actually has a 25-bed critical access hospital in Edgefield, and is now onboarding the critical access hospital in Abbeville to be part of our structure. And in community health at the hospital, that's really where our all things community live. So our AccessHealth Lakelands program, we have community health educators that provide screenings and education across our communities. The community health needs assessment and that implementation strategy really falls within us, as well as we have a peer support team that works in our ER providing the expert program to folks with substance use issues, as well as I just lost my train of thought. Oh, our mobile clinic. So we also have a mobile clinic that we'll talk more about, so that we can take care into those rural communities versus having folks having to come into Greenwood. And then as far as health equity, so that is not new to Self, but definitely a new position for Self-Regional in the last year. So really working with our community and our hospitals to understand the disparities that individuals face in our communities and how we can support them and making sure that everybody has the most equitable care possible. So to that, I will pass the mic.
Hello, I'm Brenda Anderson. I've been with the hospital AccessHealth for the last 10 years. My major job, I think, includes just taking care of the population that we serve. I'll get more into it. Right now, but we serve people with no insurance. There's objective to that. The main objective is there's so many people that don't have insurance utilize the emergency room as a primary care physician. So our objective is to try to eliminate or minimize. Let's say minimize, probably eliminate, but probably minimize the use of the emergency room for people with no insurance. And so it's as it's in the state, we work closely. We have other peers in our teams with that help with the AccessHealth program. We have community partners also that help with our AccessHealth. But we'll talk further into it as time goes by.
Good afternoon. I'm Theresa Goodman. I am the Executive Director of Community Initiatives, and we are a not-for-profit organization that serves about upwards of 7,000 persons a year in the Lakelands area. And so our area is Abbeville, Greenwood, Lawrence, Saluda, Edgefield, and McCormick counties. We have, we do a lot. So initially we started as a grassroots effort that had this apartment that we were going to turn into a free clinic. We had a volunteer doctor, a volunteer nurse practitioner, and a stethoscope. And lots of love and a lot of drive and some hope. And so now we have 5 locations. 2 of those are free medical clinics where we serve the uninsured and underinsured. We also have a neighborhood center where we have an after school and summer program. And then we have our admin building, which also shares space with our one of our free clinics. But there we do some outreach services and those type things. But we also are branching out a little bit more as we are growing and starting to serve families in some different ways. And through that, we are hopefully about a month away from opening the Toddler Learning Center, which is going to be free childcare for families who can't afford quality childcare. Everything that we do really is driven by the social determinants of health. If it does not fall in one of those areas, it's not a need for us. But of course, the free clinics are our largest programs because we have upwards of 9,000 patients on record, and we don't see all of those annually, but a good bit. We see a lot of our practices are bilingual. Most of our staff are bilingual. I'm one of the very few. And my staff tells me that although my Spanish is getting better, they tell me don't embarrass myself. Because this Southern twang does not do well with that beautiful language. So, but I will try. If you catch me there by myself, the patients, they laugh, but they try to understand what I'm saying. But we have been very fortunate to work with Self-Regional and some other wonderful partners in our area to make sure that as we are addressing the social determinants of health, we're doing that in a very comprehensive manner. And so what we'll present to you today, I think, will speak to that and give you a very bird's eye view of how we're doing this work in our community. We're really proud of what we've been doing for the past 10 years, and I'm just proud to be a partner and work with these 2 wonderful ladies that are on this panel.
Thank you. And same about Spanish. This, deep Southern accent, it never sounds right. But I try. So one of the things you're going to see here again that was highlighted earlier today by Zach and Mata is that collaboration is key to all of this work. And that's one of the reasons we brought this panel together, is to really showcase the collaborations that they have brought together to better address the social needs of their community. So I'd love to hear from the 3 of you. What are some of the unique challenges you experienced in the games area doing this type of work, and how did you work to address those through strategic collaboration?
Since I have a mic, we'll start. I think a couple of things, one being transportation. Transportation is a problem across our state, and we at Community Initiative started off needing some buses because for our after school program, we pick up up children because their parents were either at work or didn't have transportation. So we pick them up, we get them to the center, and then we make sure they get home safe. Well, as we continued doing that work and we grew, we ended up with 3 buses that were only used from like 2 to 5 o'clock. And so they sat in the parking lot the rest of the time. And so I think Cyndi and I we were at a meeting for something else. Started talking about issues that we had, and transportation, of course, was one. And the light bulb went out. Well, we have these 3 buses that are sitting down every day. And so there were 2 very particular practices that needed transportation, and we began to fill that void for those practices because they were also in the area we served, and we had some buy-in there and some trust there with the patients and the folks in the community. And so we started working in the wear shows in saluted areas to make sure that we could get patients back and forth to the doctor safely. And that was one of the things. I think the other thing I probably talk about is food insecurity. That we really, as a group during COVID, were able to band together and tackle. We just had people who couldn't get food. We had people who had multiple children at home during the day, all day now, and their food costs went through the roof. And they weren't able to purchase food, and they weren't able to purchase healthy food, more specifically. And so we were able to work together to get those things done as well. We used those same buses to drop off food to particular houses and neighborhoods, and work with the food box program that Self Regional brought in to make sure that we were able to help them distribute food as well. So it was a lot of things that we started to do, but it all came out of community need. The community needs assessment that Self Regional does. We use that to drive a lot of our work as well. And then I'll let you guys talk about some other things.
Well, I definitely agree with Theresa, transportation and food. Transportation, one of the things that AccessHealth have, we work with the Gleams, we call it the Gleams, Greenwood, Lawrence, Edgefield, Avonville, and McCormick. In the McCormick area, they have a transportation service called Max Tram. And it's where our people in Greenwood, if they live within a certain amount of, in a certain area, they can utilize that bus, that service for only $2, a trip. It don't only just take them to their appointment and pick them up and bring them back. They can go to the grocery store, they can go to Walmart. And so this program it helped our people, especially our AccessHealth people, able to go to their appointments where so many of them wasn't going because of transportation. So now, because of me, I've talked with them about, and we utilize the Max Tram, we are able to give our patient vouchers. My precious director here, she's able to purchase vouchers for us to give our clients, so they can go to their physician office, back and forth, and the number have declined tremendous, where patients wasn't going to their appointment because of transportation, but they are going now. Whereas food-wise, we also, as Theresa stated, Self-Regional, we as AccessHealth in our community are partners with us. We have something where we give food boxes, so wait once a month. We serve the McCormick, we serve the Greenwood area. And we're at different locations. We try to get locations where, no matter, where people are living at, if they need the boxes, we don't ask for financial information or nothing. If you need the box, come get the box. And so we try to go in places that we know where people can get there if they had to get there. So that's, the food and transportation, I do agree with Theresa, it's a need of ours.
And I think too, Theresa and I were talking about this earlier. So AccessHealth really started around 2013, probably really got going in 2014. And that was the same year that Theresa became executive director of Clinic Regardless, which is now Community Initiatives and has expanded just so much. And so we've been together for a while now. We've tried, I know that if I have an idea, Theresa's the first person I call to see how maybe we can make that work. And we can't always, right? I mean, you learn, you say, well, this doesn't work, let's try it this way. And again, as we mentioned, everything we're mentioning too, it's not just the three of us, it's many, many community partners that we work with. But a couple things I also want to highlight, in particular with clinical gratis, is translation services. So, as Theresa mentioned, she has a lot of bilingual staff. I say a lot. She has bilingual staff, and so they have helped us tremendously at the hospital as an organization. They'll come into the practice and translate for us. So that has been a huge partnership for many years. Also, more recently, we started working together on our mobile unit. So, Self for many years has had a mobile unit that we've taken to festivals or maybe to plants and provided different kind of screenings, diabetes screenings, A1Cs. But beyond that, it was a little bit of a billboard on wheels, right? Though it is equipped, it has two offices, patient beds in there. It's got a lab, it's got a bathroom. And so we received some funding last year to expand that, to have a provider on the unit. And we did try that, and it worked well. But again, it was, the provider was from out of state and went back to state. And so we had to sit back and think, okay, what do we want to look like, this to look like now? And so now we provide the bus. We will provide one of our community health workers, but Theresa's providers and staff are on the bus, seeing patients. And so that's going out to Saluda. We're working with Edgefield. We hope to be providing potentially some prenatal care in the next several months in Abbeville and McCormick. And again, that's utilizing that partnership, understanding both of our, what we're best at, and working together. Because again, the hospital, we understand that we can't take on all the needs, and we really need our community partners to help.
Thank you. Building off of the idea of partnership, want to ask you a little bit more about that. So to carry out this work, we understand that you have strong partnerships in place. Could you highlight some of those other partnerships that are in place to help you accomplish this work?
Yes, where do we start? I want to say we're lucky in Greenwood. We have a nonprofit council that we sit on. And so that really brings a lot of folks to the table. We couldn't do this without our food banks, or our local food bank, we have women's shelters, we have homeless shelters, again, our transportation partners. The United Way is a huge partner that offers different services, our medical closet, they now have a resource center. So again, we just couldn't do this without those partners. Also, we have, our other free clinics in the area, and then our FQHC partners. Carolina Health Centers serves the same counties that we all serve, and they also see and underinsured patients. So we utilize them a lot, specifically when it comes with HIV and hepatitis C care. They now provide medication-assisted treatment services for those in addiction. Again, it takes a village. Also, speaking to partnerships, we now have a health equity task force within the hospital, and that is a physician-led task force. And so it's some physicians from South Regional, but it's also physicians from Abbeville, from Edgefield, from Carolina's Health Centers. It's really bringing everybody. It started out with 9, I think we're about at 14 physicians. And I'm talking about OBGYNs, neonatologists, rural primary care providers, a lung specialist, because they're looking at our disparities data and they're saying, what programs, how can we impact this? We've done some work around lung cancer screening, and now we're working on maternal child health. And then on the outside of the hospital, through the United Way and the Greenwood Counts Consortium, we now have a health equity, food insecurity, and mental health work groups. So we make sure, again, that we're all part of those so that we can make impact there.
And Cyndi, I do have one follow-up question for you before you hand the mic over. I think one of the things that is unique about y'all is also your payment arrangements, and how you do reimbursements. Could you and Theresa talk about that a little bit as well as part of this partnership?
Sure, and so I'll talk about it in two ways. Self Regional has what's called the Community Health Committee, and so for years now, that committee is funded by the president of Self Regional's operations, and what they do is they grant out to our community, and so several times a year, different organizations will come to in front of the community, such as our free clinics, our food bank, women's shelter, and so that is one way that SELF is able to support those community groups. But then also, and this is new, with our new mobile clinic, Theresa can now invoice me for her provider and staff time, and then I'm able to reimburse her for that work. And so that's fairly new, but hopefully it's going to work really well moving forward.
So just to speak first before I forget, I make my notes while Cyndi was talking about the partnerships. But very specifically, we have some amazing partnerships that have allowed us to do this work. Of course, the food bank is one of our most lucrative partners, simply because there are so many people that are dealing with food insecurity. And so our food bank also has hours that close before 5 o'clock. And so for those people who get off at 3, who get off at 4, who get off at 5, they may not be able to get to the food bank. They also may not be able to afford having that day off so that they can go get food. And so we're stocked for them, so we stock food in our freezers. And unfortunately, the only thing we can offer is frozen food right now, just because of storage and because we're a medical clinic. But we're able to provide to folks, if they get to us before we leave at 5, then we can get them food. You know, we can get them frozen vegetables, we can get them meat, we can get them those kinds of things so that they at least have something until they can get to the food bank. We also can store boxes from the food bank in our refrigerators for people we know who are going to get there by 5 to pick up their food. So they may call the food bank, and the food bank will prepare something and say, hey, you can pick it up at community initiatives. Now we have 5 locations, that's the other thing. And so our 5 locations are in different places. And so if that person is closer to our Piedmont Tech office, then they can get it from Piedmont Tech, where the food bank now has a food pantry as well. So it's just different things, and all in how you look at it and how willing you are to be a partner. One of the other amazing partnerships that we have is with MUSC, and they're able to provide us through their diabetic program, their combination glucometers and blood pressure cups. And so our patients can get those through our program with them, and they can go home, they can take their blood pressure every day, their blood sugar every day, and we can see all their results on our computers. Well, the wonderful thing about that is if you don't have a way to get to us and you're in Saluda and we're in Greenwood, we can look and see, okay, Amy's having an issue with her blood sugar. We can call her and do telehealth. Those things, without that partnership from MUSC, we wouldn't be able to do that. SC Thrive is a huge partner of ours because in all of those counties we do provide the Thrive Hub services. And so we've been a partner with them for many years, but we have so many people who come to us for one thing and they're able to get many things, and that Thrive Hub partnership allows people to, especially when they're dealing with transportation issues, to come in and get kind of a one-stop shop. Well Vista as well, they can get their medications, get those things mail ordered to them so that they get their medication. And then we have people like the Department of Mental Health, because everybody who steps into our free clinic gets a depression screen, because what we know is if you're dealing with not having insurance, not having enough funds to manage, then you probably have some other stresses, and we want to take care of your whole self. And so those things are automatically going to happen. You're automatically, if you come to our free clinic, going to have a transportation option. You're automatically going to have Thrive Hub option. You're automatically going to be connected to the MUSC program. You're automatically going to be connected to Unive if you need it. All of these different things, the food bank, and then AccessHealth. I think that's one of the things that we've developed in these past years that has been critical for our patients, because they need those specialty visits that they'd be unable to get otherwise. And so these partnerships, I think, speak very well to what we need and how we serve and how well we serve our patients.
Thank you. So my next question is for Brenda. So we are increasingly investing in the state and seeing the importance of the role of community health workers. Could you share a little bit with us about what your role in this work is and what your daily roles and responsibilities are in the community?
Yes, ma'am, thank you. My daily basic routine is getting up early in the morning, excuse me, getting up early in the morning, basically looking at my schedule. If there's patients or clients of mine that have an appointment in one of our Gleams areas, sometimes we're out of the Gleams area. If there's something that we can't get our patient to, we often reach, we have in the Greenville, if there's something free or at a lower cost that they can get it done in Greenville, we're in Greenville. So I'll look at that schedule daily, and if they've got an appointment with their PCP or any specialist that they are offered, I go there with them. I don't take them, they get there. I advocate with the doctor with them. And when I say advocate with the doctor, with their PCP or whatever physician they're seeing that day, if that doctor is talking about they need a medication, and most of the people we serve, AccessHealth serve, is people with no insurance. So I'm there telling the doctor the programs that we can offer for our clients to get medicine. The Well Vista program, as Theresa mentioned it too, we are on with the Well Vista program, where it's a mail order, where our people are able to get a 90-day supply of medicine free, and it comes through the mail. So we definitely utilize that. South Regional is blessed to have the medication management program, where they can, and it's not only for the uninsured, but it's also for the insured. If that medicine is high, they can find ways, they look into ways to find at a discount price or a free price. The medication management program does. So, like I say, I'm advocating with the doctors on a daily basis about, the client's medicine. If this their first time using insulin, their first time being the blood pressure patient, he talked about that. I would let the doctor, we got the list, and we tell the doctor, if you can look at this list and put them on there. One of these medicines, of course, he tried to do it. Okay, explaining to the client what the physician is saying. Sometimes even, we might go to the doctor might talk, so we really don't know what, he's saying. So with our clients, we try to go with them to these different appointments, and you see so many, so you start getting the knowledge of what the physician is saying, so you can explain it to the client a little better. They hear from you. I'm their case manager. They might, they sit up there and just shake their head, but if they don't understand it, they can feel comfortable enough to say, even when we want to leave, hey, Ms. Brenda, what did he say to this, or whatever it is. And so we're there for them. That's our daily job. We're there for them, to whatever needs they might have. And, sometimes it might be other needs that they might have, but we need to meet them with other things that they need, for as food, social needs or whatever. We know our clients, we document, we talk with our clients, we follow up with our clients. So we know their needs, they get comfortable enough to tell us when they're having social problem, maybe they're without food, maybe they're losing their homes, they don't have nowhere to stay, or, they're homeless. So with all the resources that we provide for them, we're able to give them resources, and we work along with our patients. We work, we just don't tell them that. We work with them, we follow up with them to make sure that they, have the needs, get the needs that they're having the problem in. But, our basic daily is every day is to follow up with our patient. We have, we're growing, which is, great, but there's so many needs out there, and, there's some, and we can make a difference in one person a day. We have done it.
Thank you. That's really powerful. I think one of the things that I also want to highlight is the Games area is a big region. too as well. And so there's not always enough resources to go around. And so I wondered if y'all could talk a little bit more about how you're using technology or other resources to kind of solve some of these challenges. In particular, I know that you're now using Thrive Hub to help individuals apply for benefits, and recently purchased Unive as a case referral management platform. So if y'all could share a little bit about how you use those technologies to better support patients.
Sure. So yes, so we actually are in part of the pilot program with Palmetto GBA and Unive. And so just in the past 3 or 4 months, we implemented Unive. If you don't know what that is a closed loop social determinant referral system. And so that has been, I think, for us, really a game changer from the aspect of twofold. So we're getting our team, of course, at the hospital utilizing the system, but at the same time, we've been getting our community partners to join the system so that we can make those referrals. And so in the past, again, we're still making the referrals, but that may be a couple phone calls, that may be a couple days, depending on, or maybe sometimes you don't know if a patient followed up or not. So this has really allowed us to be able to, or Brenda to be able to say that food bank referral. I can tell the patient and give the patient the resource about the food bank, but you can also then put that in Unive. The food bank will see that and will let us know, hey, Mr. Smith came by and got their food box or not, or maybe there's a transportation issue. So it's been a great asset to us. And then it's just, even as we're still onboarding certain programs, we still can capture those referrals in the system, for one, so we can then go back to the partner and say, hey, I've sent you 20 referrals in the past month. Don't you want to come on board and utilize this tool? But it helps us keep up too, just for ourselves, what referrals we're making so that we can go, whether it's back into the community or even within the hospital, saying, hey, this is really a need. We've made these transportation referrals. They cannot be met. What else can we do? Or maybe what other partners can we look at? And then I'll let Theresa talk a little bit about Thrive Hub, but I'll say too, I said this a minute ago, the hospital can't do everything, right? I think when we first started AccessHealth and we were seeing all our patient needs, we were like, oh my gosh, how are we going to do food? How are we going to get, like we felt like we owned all of it. We quickly learned that we had wonderful partners that could help build capacity, and Thrive Hub is one of those. Especially now with Medicaid unwinding, but some additional Medicaid reimbursement funds coming into the state, it is an opportune time to get people enrolled in Medicaid if they're eligible. And so that's another way that we work with Theresa and her team, making sure that we are referring patients to them for that service. And we can utilize Unive. Unive.
So with Thrive Hub, it has been a mainstay of our program for many, many years. But what I will say is SC Thrive offers so much that we partake in. So their training is awesome. They have a great annual conference, so you guys go to that. But one of the things that I want to highlight that we also do through SC Thrive is the poverty simulation. And if you guys haven't done that, I would tell you, please give them a call and do that, because what it does for the people in your community, your partners and those who are working with you, is open their eyes to what's happening to people who have to go through challenges on a daily basis. We were just talking about at our table that folks who have to manage, using us for medical home and somebody else for this and someone else for that and having to get transportation. We are overlooking folks who have some amazing management skills and time management skills, because we would not probably be able to juggle all of those balls and keep them in the air. But the poverty simulation allows folks to see, especially people who've never experienced adverse, effects that are happening in their lives. It helps them to see how folks manage. The people that we serve, who often shoes we have not walked in, what they're living on a day-to-day basis. And so that's the amazing thing that we get from SC Thrive. But with Thrive Hub, majority of our patients, and there's a huge amount of misinformation out. And so people will say, well, I can't get, SNAP because, and then we'll be able to give them education and say, yes, you can. Well, once you do that, a person wants to apply for SNAP. What you don't want to do is tell them, okay, next time when you come back, we'll do your SNAP. We can do their SNAP application right then and there. We have 5 people on our staff who will see. We have someone who is stationed at our clinic. We have someone who's at our community center. We have our staff who takes care of Piedmont Tech. They're all trained and they can all do the applications. But then we also have a benefits coordinator who can go anywhere. We have about 6 places in Greenwood, Lawrence, and Abbeville counties where we see patients. So monthly we can go. We also see them at the food bank, and we can take this service. It's mobile, and so we can go wherever the folks need it. We meet at the library in Lawrence County, and folks can come there and we'll do their SNAP application. You have people who have trusted relationships with us because they come to us for their health care, and they want to stay there and get those services as well. So Thrive Hub has been, and for what it was called Benefit Bank, because some people may be familiar with that, it has been a tremendous thing for our patients and our staff, because our staff have been able to go to their church and say to their church, hey, I can do this for you. So it doesn't have a time, it doesn't have a necessarily place, but it does have a long-reaching effect to help folks. So I would tell you to just look at the SC Thrive and all the wonderful things that they are able to provide.
Thank you. I think we have time for some questions if anybody wrote them down. If you want to just hold them up and someone will come get them. In the interim, I have a quick question for you about, so what are some of the unique challenges that you think that rural communities experience in doing this work? I think so often, we focus on the major cities. So what is unique about a rural community, and how have y'all been creative in solving that challenge?
I see Teresa's going to speak more to this, but in rural communities, there's just not, me and Brenda were talking about this a while ago, there's not always resources, right? I mean, that's when you have to get creative. There's not funding either, or even if it's, I know a lot of folks that have schools nearby can use a local school, and we don't have those options. We still serve some communities that have zero transportation, they have zero food bank, they have, so it's really trying to work with the folks who are there to serve and kind of think outside the box.
So I think one of the best things, and I guess this is because I grew up in rural Clinton, South Carolina, and so I think I look at it from a different perspective. We have to talk to the folks who are out there and see what they already know, because sometimes these problems are already solved. People have been doing it for years. We just don't know about it. So I think one of the most important things is asking people, how'd you do this before? Have you ever? What do you think about? And we often learn our lessons from those that we serve, because they are the experts and they know what they need and how they like it. And I think that's one of the things that we often forget is pay attention to who we serve. Sometimes they have the answers. We can put the things that need to, we can connect the dots for them, but a lot of times the things are already out there. And so what we need to do is pay very close attention and respect those that have this lived experience so that we can better serve them. So I think a lot of times with the rural aspect, folks have lived in rural communities in this state for lifetimes. And so what we need to know is, how do we just connect those dots, find out what they have, what's working for them already, and how do we help them get through that. And I think a lot of times it's not often as hard as it is on paper.
Good answer. So I have one quick question and then want to move on to some others. How are you funding the free clinic or the full circle clinic?
I say grace and mercy, grace and mercy. But one of the ways is through our South Carolina Free Clinic Association. There are grants there through Department of Health and Human Services, Blue Cross Blue Shield South Carolina Foundation. And one of our largest funders is right here, Self Regional, is that community outreach committee. And they recognize the work that we do, but we have also given them outcomes. We tell them, here's what we're going to provide for how many of our people. Here's how we're going to change the rate of people who come into your emergency department who can't pay. Here's how we're going to lower the A1C of our patients who come into our clinic. And so that's one thing. We have recently applied to the Duke Endowment for a maternal health expansion program called HOPE, because what we know in our state is maternal and infant mortality is ridiculous, and we're losing people unnecessarily. And a lot of those folks may be uninsured, and so if we don't tackle that problem at that level, then we won't start to see change there. And unfortunately, as we progress in time, those numbers are going backward. And so we're reaching out to those type partners. We also have local community foundations, United Ways, and those people who fund us as well.
Okay. One of the things that came up a lot in your conversation was food and food access. So twofold questions. I think maybe you touched on this earlier, but do your programs require an ID to be able to receive them? And how are you facing the challenge of people who can't access food during normal working hours, like an 8 or a 9 to 5, because they're at work?
So I'll just answer that quickly and I'll pass to Cyndi. For us, some of our patients will not have an ID. There are other ways that we have figured out that we will allow them to identify themselves. And one of the things that we do is we respect and we believe people when they tell us something. You have that gut instinct. If you know someone is telling you this is what it is, but this is all I have, we're going to trust that, and then we figure out ways to give them what they need. A lot of our patients, we have patients who have been incarcerated and don't have ID. Well, they can become a patient at our clinic and get our clinic ID, and they can take that and use it to get a license. So as my brother says, there's more than one way to skin a cat. You just have to figure out how. And so those are ways that we do. And then once they have those things, so our food bank will also recognize their La Clinica Grada's medical clinic ID. And so those are things that you can do in your community because you're a trusted partner. They know, hey, they have the clinic ID, that means the clinic has done the background and they know they live in this area and we can serve them. So that's one way.
Another way is an example of last Friday, we were in Greenwood, we gave away food boxes. There's sometimes, like I say, there might be several left, we get it from Golden Harvest, Food Bank or wherever. They come out there with, tons of boxes. So last Friday, we were able to do it for this month. And when I left there about 12:30, we get there at 8 and we're there to about 12:30, whatever, until people just, kind of stop coming. When I left there, I had about 15 sets, and it's not just 15 boxes, 15 sets of boxes in my car. It's a dry produce, it's a meats, and it's a vegetable boxes. So I had 15 sets in my car. Once I got there, after they left, I went to distribute those boxes. I got clients that don't have transportation at all, so I took some boxes to them. We have the Pathway House here in Greenwood. I can take boxes to them, or I just, in certain areas, and almost got areas that you can drive up to that, somebody might need something. So I drove up to the area, and if someone needed a box, I offered them a box. But one of the things about it, even though my job is from 8:30 to 5, If I know I got a client that needs something, or I know someone that needs food, it doesn't matter, it's at 5 o'clock I get off. Their need is my need. So I need to take them there, something to eat, if we can do. So working after our hours is nothing, you know, we do that. If we have to, we got to make sure our people serve.
Thank you. And that's why community health workers are so important in this state. So we have just a couple of minutes left, and I would just like to close with some final thoughts from each of you. What is something you want this group to know, whether it's, you know, something that someone told you years ago when you started this work, or something that will, you know, hopefully contribute to success moving forward. Just some final closing thoughts.
Being a community health worker, even though I'm certified and I often tell my director, I'm the CEO of AccessHealth. And everybody knows, but essentially speaking, being a community health worker is, you know, I'm certified, it's time, but each of us can be community health workers. It doesn't mean that you gotta be certified. You know, when you go out in the community, you see someone that is in need of something, you can be that community health worker. I'm gonna tell you a quick story about a client I had some years ago, maybe about a year ago now. She was coming to the doctor often. I was her case manager. She'll come to her PCP office, and I usually get there about 15, 20 minutes before the doctor come in there, so her and I can get to interact. And as time goes by, she had been going to the same physician over and over, and she was complaining about headaches. She didn't know what was going on with her. And as she kept coming, she would tell me, Miss Brenda, the doctor who she's talking about, he's just not doing nothing for me. You just need to find me another doctor. She's very angry and all. But at the same time, I know that she's taking care of her mom. Her mom has a chronic condition. So she's taking care of her mom, plus she have her 2 kids. And then on top of it, she don't have no income. She don't have a job. And so, but the doctor, she kept talking about she having headaches. The physician is ran all kinds of tests, gave her medications and things. Nothing seems to work. The physician is not doing nothing for her. So one of the days, when I get there, I still, talk with her when she come in. I was telling her, I said, well, how was your weekend? She asked me, I said, I went to church. And so that started clicking with her. So then one day she came back and I said, well, how was your weekend? And I was at an appointment. And she said, Ms. Brenda, I went to church. And she said, you know what? I think it did me good. And I said, I'm so glad. As she went to church and she started telling me about different things, and she started getting more and more. The thing about it, the moral to the story is this lady, medical need turned into her social need. And the reason I say that because at the end of this, she started, the medicine, what the doctor was giving her worked. So it wasn't really the headaches that she was it was what she was going through. I went with her as time goes by. I went with her to take her. I didn't take her, I met her at a job site. Told the people that she needed a job. She put in an application there. I took her to another job site. Told a Kentucky Fried Chicken, this lady needed a job. And she put in an application. Today, and like I say, this was in a year today, that lady is a system manager and she has a job. Our people, it's not just because of who we are. Any one of us can be a community health worker.
How did you follow Miss Brenda? But she's amazing. I'm giving you a flowers because I call her too and say, Miss Brenda, what do you think about it? She'll tell me. But I said lead with love. If we have all the education in the world, we are very privileged in where we live and where we work, but we forget sometimes that everybody is in a place or could be in a place where they need something. And so if I leave you with nothing else, lead with love. And I think if we do that, judgment falls away, just all kind of things fall away. And then we're able to really get down to the crux of what we do, and that is helping people.
Y'all are amazing. So one last thing I would say is, if you're in this room, you have power. So use that power to make change, to be an ally, to be an advocate for those that you serve.